If you have sleep apnea, you are 2 or 3 times more likely to develop type 2 diabetes, even if you are lean, even if you eat well, even if you exercise. Did you already know that? And here what makes all of this really disturbing. If you have type 2 diabetes, you're significantly more likely to develop sleep apnea. And once you have both, oh my gosh, they feed each other in a vicious cycle that most doctors don't fully explain. In fact, they don't mention it at all. So today, we're going to go deep into the hidden metabolic pathways, the connections for these things, these two specific conditions. And I'm going to show you that this isn't about necessarily your body weight, obesity, the amount of body fat you carry or don't carry. It's about what's happening at the cellular level while you sleep. That's the most important part of the phenomenon to understand. Let's uncover together what's really going on. Hi, I'm Dr. Beverly Yates, MD, licensed doctor of naturopathic medicine, over 30 plus years of clinical experience. And in my work, I've helped thousands of people to reverse type 2 diabetes and pre-diabetes. And in this healing moment, it's so important to have clarity about what the things are that are affecting your health and your role in making things better. And also make sure you can have health professionals around you who can help you so that you can have the healthiest possible life. All right, let's get into the topic. So first, let's get something out of the way. When most people hear sleep apnea and diabetes, they immediately think, well, that's just because both are linked to being overweight. And yes, obesity is a risk factor for both of these conditions. That's true. But here's also what's true. What makes this relationship, frankly, fascinating and also terrifying at the same time, lean people with sleep apnea develop type 2 diabetes at alarming rates. And they may stay lean. Their weight may not budge, and yet they can wind up with both conditions. And lean people with type 2 diabetes develop sleep apnea more frequently than you might think. I've had a chance in my 30 plus years of clinical work to work with quite a few people who've had this experience, and they're often confused and angry because they like nobody talked to me about this. They feel like they should have no risk. And you know what? Oh boy, let's learn why these things are related. All right, so this tells us something crucial, that there is a direct mechanism, a direct link between these two conditions that have nothing to do with body fat. So we're going to explore together today two pathways. Number one, how sleep apnea actively damages your glucose metabolism. That's right, your body's ability to regulate your blood sugar and can cause type 2 diabetes. And second, how diabetes affects your breathing regulation and can cause sleep apnea. It could go both ways. So think of it like this. These two conditions are like dance partners in the worst possible kind of tango. Each one makes the other worse. They amplify each other, and if you don't understand how they're connected, you can't break the cycle. So let's start with the first pathway. All right, now I'm going to talk about how sleep apnea causes type 2 diabetes. That's right, disordered sleep all by itself can cause type 2 diabetes. When you have sleep apnea, your airway repeatedly collapses during your sleep. You stop breathing, and the body perceives this as an emergency, which it should. It is an emergency, right? So you can stop breathing for 10, 20, even 60 seconds or more at a time. This is a big deal. There is nothing about human health where oxygen is optional. We have to breathe. Now, this can happen dozens or even hundreds of times a night. Now, most people focus on the fatigue, the brain fog, the tired feeling, the lack of energy, the snoring, the amount of noise they might make that disrupts anyone that they sleep with or others in their household. They may also have this where they have an increased accident risk because they're more likely, for instance, to fall asleep while driving. It can be as dangerous as drinking while driving. It's that big of a deal to have sleep impairment, just like it is to be impaired with alcohol. But there's something that's happening at the cellular level that's destroying your metabolic health. I provide more details on the relationship between sleep and blood sugar levels in my book, The Yates Protocol: 5 Simple Ways to Fix Your Blood Sugar and Reverse Type 2 Diabetes. Make peace with food and never feel deprived again. Now, let me break down 4 specific mechanisms that mess up metabolic health. Number one is something called intermittent hypoxia, which is the oxygen deprivation problem. Your body is being deprived of oxygen and it's not happy about it, okay? Now, every time your airway collapses, your blood oxygen level drops. This is called intermittent hypoxia, a fancy way of saying that there's multiple episodes, repeated episodes of low oxygen followed by reoxygenation. In other words, you don't breathe. You have the apnea event. Apnea, the word means without breath, without air. And once you wake up, you're startled. Your body's like, whoa, we didn't breathe. Oh no. You take in probably a deep breath. You might gasp, you might snore, kind of a sound. That's reoxygenation, right? That whole cycle is called intermittent hypoxia. This creates cascading disaster for your glucose metabolism. First off, this low oxygen event, hypoxia, triggers something that's called oxidative stress. That releases lots and lots of free radicals. In other videos, I've talked about what free radicals do in destroying your blood vessels and other aspects of your body, including your nerves. So think of it like rust forming inside your cells, if that's a helpful image for you. We all know that oxidative stress or rust can hurt metals, make them weaker, and cause things to break. So a similar process can happen in a body. And this oxidative stress damages directly the beta cells in your pancreas. Those are the cells that make insulin for you. These cells produce insulin. Fewer functioning beta cells in your pancreas means less insulin production. But oh my goodness, it gets worse. When your body senses low oxygen, it activates a protein called HIF-1 alpha. That stands for hypoxia inducible factor alpha. This is your body's emergency response system. And one of the things HIF-1 alpha does is it tells your liver to produce more glucose. That's right, more blood sugar, because your body thinks that you're in a survival situation. You might as well be running away from bears and tigers in this situation, but all you're trying to do is sleep. So this kind of struggle goes on and it completely hijacks your blood sugar. So in this situation, you've got two problems happening at the same time. This simultaneous chaos is a problem for your metabolism. Your pancreas is producing less insulin while your liver is dumping more blood sugar, more glucose into your bloodstream. Wow, this is not good, right? This is a recipe, almost a guarantee for high blood sugar. And it's happening night after night after night. Now, this is a time where it is an excellent idea to use a CGM, a continuous glucose monitor, so you can see exactly what is happening with your blood sugar on a 24/7 basis, all 24 hours of the day and night for 2 weeks at a time. It is especially important to know exactly what's happening with your blood sugar while you are asleep. Sleep, as I've said in other videos, I'm going to share it here. Sleep is the beautiful healing opportunity each and every night for our blood sugar to reset. It's a wonderful opportunity for your health and healing. Reset for your body, your mind, your gut, your soul, your everything, right? For your blood sugar specifically to return to the healthy range. Now, for many people, this is where the silent, relentless damage occurs, and they are unaware of the danger it presents to their health, including increased risks of heart attacks and strokes. If your glucose spikes high while you are asleep, you need to know about it and take action to find out why this is happening. Now, the next specific mechanism that messes up metabolic health, something called sympathetic nervous system overdrive. That's your fight or flight system, is the sympathetic nervous system. When it goes into overdrive, there's trouble. All right, so to be clear, oxygen deprivation is not the only problem. Every time you stop breathing, your brain panics. It jolts you awake. Usually not to full consciousness, you rouse a bit, but enough to restart your breathing. Now that's a good thing, it's saving your life. However, every single time that this happens, your sympathetic nervous system fires. It gets kicked off. This is your fight or flight system. Your adrenaline surges. Your cortisol spikes. Your body is responding to what it perceives as a danger, and it's perceiving that correctly. Now, cortisol, as we know, is a stress hormone, and one of its primary functions is to raise blood sugar. Why does it do that? To let you deal with an actual emergency, like if you need to run away from a danger, like a bear or a tiger, or you need to stay and fight, right? It's giving you extra energy to meet that moment. So it's trying to give you energy to deal with whatever emergency that you're facing. But the problem here, friends, is that there is no emergency. You are asleep. This should be a peaceful time of day. You're just trying to sleep. But this lack of oxygen is not peaceful. It has big effect. So, when cortisol is chronically elevated, night after night, it creates insulin resistance. Your insulin just isn't as effective at bringing your blood sugar out of the bloodstream, taking your glucose inside your cell to make it available for energy. And instead, you go into storage mode, and usually it's going to park more and more of that excess blood sugar, that excess glucose in the liver. Okay? This can start to build up your body's stores of body fat. Even though maybe you appear to be lean, you might still have a struggle with visceral fat. Fat in the abdomen, fat that's stored in the liver, fat that is behind that abdominal wall. Your cells stop responding properly to insulin signal. The insulin is there, but it cannot do its job of moving glucose inside your cells. And here's why this matters for lean individuals. This mechanism has nothing to do with how much body fat you have. If you have sleep apnea, your sympathetic nervous system is being activated repeatedly every single night, driving insulin resistance regardless of your weight. Now, the next specific mechanism that messes up metabolic health is number three, sleep fragmentation and hormonal chaos. What do I mean by these things? Okay, let me explain it. Now, even if you're not fully waking up during these apnea episodes, your sleep architecture is being destroyed. You're not spending adequate time in deep sleep or REM sleep, rapid eye movement sleep. And this creates three specific hormonal problems. First, growth hormone. Growth hormone is primarily released during deep sleep, and it plays a crucial role in glucose regulation. When your deep sleep is fragmented, growth hormone secretion is impaired. You need to be able to get to that cycle of sleep and stay there. That's also actually when your brain does a lot of very important refreshing and resetting. Second, back to cortisol. Now, normally, cortisol, that stress hormone, should be lowest at night and rise in the morning. That makes sense. When you're sound asleep, it should be peaceful. There should be no reason for you to be in superhero mode while you are asleep. But if you aren't breathing, haha, oh yeah, you need to be a superhero, right? To wake your own self up and breathe to get that oxygen in. So, with sleep apnea, you get elevated cortisol in the evening and throughout the night. This creates 24-hour metabolic dysfunction. It's as if you have daytime levels of cortisol when you should have nighttime levels of cortisol. The daytime cortisol naturally should be higher. Nighttime, it should naturally be dramatically lower. And in this case, it's entirely too high while you're trying to sleep. And the third one here, and this one can affect your waking hours. Your hunger hormones get dysregulated. Ghrelin goes up, leptin goes down. You wake up hungrier with more cravings, particularly for high carbohydrate foods or for savory umami foods like, say, biscuits and gravy. Sound familiar to anyone listening here? Your body is literally driving you towards behaviors that will worsen your blood sugar control. Oh my goodness, this is so not fair, but you totally need to know this is what's happening. This is why it's going on. And if you are recognizing this for yourself or in someone you know, kindly share this video because it's important that people know what in the world is happening. All right? So, even during the day, you're fighting an uphill metabolic battle because of what happened while you were sleeping. All right, now the fourth one here, this specific mechanism that messes up metabolic health is chronic inflammation. Yeah, we have to talk about inflammation. Intermittent hypoxia, that lack of oxygen repeated hundreds of times a night, is so dangerous. It doesn't just damage cells directly, it triggers a chronic inflammatory response. Your body releases these inflammatory markers. Some of them are TNF alpha, interleukin 6, and in particular, C reactive protein, also known as CRP. There's a particular lab test called high sensitivity C reactive protein. And if you're going to get a lab test done, I really recommend you get this HSCRP lab test done. It's a great marker, and it's one of those ones that can be something that precedes the issues that show up when people have heart attacks and strokes. People who have sleep apnea are at higher risk of heart attacks and strokes. They're at higher risk of high blood pressure. They're at higher risk of type 2 diabetes. People who have type 2 diabetes are at higher risk of high blood pressure, heart attacks, strokes, and sleep apnea. Can you see how these metabolic things are related and why it's important to understand them? Okay, so these inflammatory molecules circulate throughout your body and they have a very specific effect. They interfere with insulin signaling. They directly cause insulin resistance. They are essentially blocking the insulin receptors on your cell membranes. It's so unfair. Now think of insulin as a key and the receptor as a lock. Inflammation is like someone jamming gum into that lock. The key is there, but it can't turn. This is systemic insulin resistance all over your body, all over your organs, being created by inflammation. And it happens independently of whatever level of fat tissue you already have. And I should mention, there's actually another development factor that can contribute to sleep apnea independent of weight. For instance, if you weren't breastfed as an infant, you may have developed a narrower airway, a higher arched palate, the back of your mouth, or weaker airway muscles in your throat and neck. This is really about craniofacial development, and it's yet another reason why lean individuals can have sleep apnea along with people who are overweight or obese. So the weight isn't the real issue here, it's what happened when you were a little one. Just another piece of the puzzle showing that this isn't simply about obesity. People really do, as clinicians, need to think more broadly about what are the root causes and meet people where they're at to be helpful. So that's how sleep apnea causes diabetes. However, this relationship also flows in the other direction too. So, what are your thoughts? I'd love to hear from you in the comments below. If you find this video helpful, please like the video, share it, subscribe to the channel, and turn your notifications on. This actually helps other people who care about their health, who perhaps have diabetes, blood sugar concerns, or sleep issues, find this video, and this means we can help more people. That way you can help me grow the channel and reach more folks with this information. Thank you so much. All right, next now. Let's look at how type 2 diabetes causes sleep apnea. Let's look at it from the other direction. All right, so let's flip it around. How does having type 2 diabetes increase your risk of developing sleep apnea? This one is less talked about, but the mechanisms are equally concerning. Here's the first mechanism, which is autonomic neuropathy. If you've had poorly controlled blood sugar for an extended period, you're at risk for diabetic neuropathy, nerve damage. Most people think of this affecting the feet and hands, but it can affect any nerve in your body. This includes the nerves that control your breathing. That phrenic nerve controls your diaphragm, and that's important. That's your primary breathing muscle. That's the one that's shaped like a dome just below your rib cage. Other nerves control the muscles in your upper airway that are supposed to keep your throat open during your sleep. When these nerves are damaged by chronic high blood sugar, the muscles they control become weak and less responsive. So even if you are lean, whatever your body size may be and body composition, even if you have no excess tissue in your throat, if you have a narrow neck, whatever your situation may be, if your airway muscles cannot maintain proper tone during your sleep, your airway is going to collapse. This is direct nerve damage from diabetes causing sleep apnea. Now, here's the next mechanism, which is fluid redistribution. Now, here's one that surprised me the first time I learned of it because I had not heard of this, but when I thought of it, I was like, oh, this makes sense. Insulin resistance affects how your body handles specific fluids, sodium in particular. Sodium is another word for salt. When you're insulin resistant, your kidneys retain more sodium. And where sodium goes, water follows. So people with poorly controlled diabetes often have fluid retention, particularly you see it with pitting edema, fluid in the lower legs, swelling that's there, even if it's not obvious edema. Could be subtle, it could be obvious. Now during the day, gravity pulls that excess fluid down into your legs. For many people, they spend a lot of time seated, they aren't walking, they aren't otherwise moving around, so they're absolutely going to have a lot of fluid in their legs, a lot of edema, swelling. But at night, when you lie down, that fluid redistributes throughout your body. It evens out, if you will. So it's going to move from your legs and redistribute all over the body. And some of it accumulates in the tissues of the neck and the upper airway. This is called rostral fluid shift, and it narrows your airway during sleep, increasing the likelihood of a collapse. So unfair, right? All this is going on while you're asleep. Oh my goodness. And again, this can happen in a person of any body size, and this includes people who are lean. This isn't about neck circumference, from fat deposits, or any other reason, from muscle, whatever it might be. This is about fluid accumulation from metabolic dysfunction. Right? Next, we have a third mechanism, which is glycation of respiratory control centers. Now, I've talked about this before, and let me explain. When blood sugar is chronically elevated, when it's too high, glucose molecules, also known as blood sugar, attach to proteins normally that are found in the blood in a process that's called glycation. So the extra blood sugar is sticky, it sticks to these proteins, and they form way bigger complexes. And this is what's called advanced glycation end products, AGES, AGES. And these AGES can accumulate in the chemoreceptors in your brainstem, the sensors that tell your brain when oxygen is too low or carbon dioxide is too high. When these sensors are damaged, your brain's respiratory response becomes blunted. You literally become less sensitive to the signals that you need to breathe more. Whew. So your brain doesn't respond as quickly or as strongly when your oxygen drops during sleep. This worsens sleep apnea episodes and can even contribute to central sleep apnea, where your brain simply doesn't send the signal to breathe. Wow. All right. Here's a fourth mechanism, which is oxidative stress. All these free radicals damaging and impacting the upper airway. Now, finally, just as intermittent hypoxia, the lack of oxygen, creates oxidative stress that damages metabolism, chronic hyperglycemia creates oxidative stress that damages airway function. High blood sugar generates reactive oxygen species, those rust molecules that we talked about earlier. Those are the free radicals that get produced and do damage all over. In particular, this damage can happen at the neuromuscular junctions in your throat muscles, where your muscles and nerves come together. These are those important connections that unfortunately are under attack in that situation. The result, even if the nerves are sending signals, the muscles can't respond properly. Reduced muscle function means a collapsible airway. So now you can see how diabetes directly causes or worsens sleep apnea through multiple mechanisms, none of which require obesity. So let's pause a moment, take a step back and just look at the bigger picture. What does sleep apnea and type 2 diabetes actually have in common? What's the unifying thread? Unstable blood sugar. Sleep apnea creates blood sugar variability. Your blood sugar swings wildly throughout the night and into the day. You develop impaired glucose tolerance. Your body loses the ability to smoothly regulate blood sugar. As I've mentioned multiple times, all of this leads to increasing insulin resistance. Now, diabetes by definition means your blood sugar control is impaired, and this poor glycemic control affects everything, including your breathing regulation and nerve function. So you end up in this feedback loop. Sleep apnea makes your blood sugar unstable. Unstable blood sugar damages your breathing control. Poor breathing worsens your sleep. Worse sleep further destabilizes your blood sugar. Round and round it goes. Oh boy. And this is why treating just one condition often isn't enough. If you only treat the sleep apnea but ignore blood sugar management, you're leaving half the problem in place. If you only treat the diabetes but ignore the sleep disorder, you're fighting against nightly metabolic sabotage. This is why lean people can be caught in this trap just as much as anyone else of whatever body size. Because this isn't about just fat tissue, it's about metabolic regulation and cellular function. So, what do you do about it? What are your thoughts? I'd love to hear from you in the comments below. If you find this video helpful, please give it a like, share it, subscribe to the channel, and turn your notifications on. This actually helps other people who care about their health, who perhaps have diabetes, blood sugar concerns, or sleep issues to find the video. And this means we can help more people. This way you can help me grow this channel and reach others with this information. Thanks so much. All right, so let's talk about breaking the cycle, what you can do. If you understand the mechanisms, you can target the interventions more effectively. So let's talk about breaking the cycle from both sides. Next, let's address this, addressing sleep apnea to improve diabetes risk. First, if you have or suspect sleep apnea, getting it diagnosed and treated is crucial. This is something you must take care of. It is literally life-saving. CPAP therapy, continuous positive airway pressure as a therapy, is still the gold standard for treating sleep apnea effectively. And studies have shown that consistent CPAP use improves insulin sensitivity. You're eliminating the intermittent hypoxia, reducing the sympathetic overdrive, and allowing proper sleep architecture, including the ability to get to deep sleep, all the stages of sleep, to restore. Your hormonal regulation improves, inflammation decreases. Now, if the CPAP isn't tolerated for some reason, there are other options. There are oral appliances that can reposition your jaw. You can discuss that with your dentist or a similar therapist. There's positional therapy if your apnea is position dependent. Some people sleep on their back, and that might be a large part of the problem. Other people put a small amount of an easy to remove tape to help keep their lips closed. There's lots of approaches here. And in some cases, surgical interventions, perhaps to help open up that upper airway, might make sense to address anatomical issues. This really can vary. It depends on what that person needs. But here's the key. Don't leave sleep apnea untreated because it's just snoring. It is not just snoring, or because everyone is tired. Friends, no, we're supposed to be energetic throughout our lives. It isn't normal to be tired. This is actively destroying your metabolic health. All right, now let's look at it from the other way, addressing diabetes to improve sleep apnea. On the flip side, if you have type 2 diabetes or prediabetes, aggressive blood sugar management becomes protective against sleep apnea. Stabilizing your glucose means less neuropathy progression. That's a good thing. You want your nervous system to be working for you, not against you. Reduced oxidative stress. The damage of all those free radicals is cumulative and goes around and harms all sorts of things. That's not good. You want to deal with that, right? Better fluid balance. Reducing fluid, reducing edema, reducing swelling, that's always a good thing. And then protecting your respiratory control centers. That way your body can send you correct signals to breathe and to not struggle with something that should be an automatic feature. So this means paying attention to meal timing, focusing on low glycemic, nutrient dense, healthy foods, considering continuous glucose monitoring to understand how your individual body responds, and working with your doctor on appropriate medications if needed. You're welcome to join the email list to get more info here. And if you already have both conditions, understanding that managing your blood sugar will make your sleep apnea treatment more effective, and treating your sleep apnea will make your diabetes management easier. So here's a synergistic approach. Let's bring it together. The most powerful approach is treating both of these at the same time. That's right, simultaneously. When you address sleep apnea, you see improvements in fasting blood glucose, hemoglobin A1C, insulin sensitivity, and finally, blood pressure. Yay, that's great. Blood pressure can be severely affected by both type 2 diabetes and sleep apnea. That'll be a separate video. When you address glucose control, you see improvements in sleep quality, breathing stability, nerve function, overall metabolic health. These conditions amplify each other in both directions. So your response, your treatment needs to address both. All right, so here are our takeaways. This is what I would love for you to take away from this. Sleep apnea and type 2 diabetes are not separate, unrelated conditions that just happen to occur together in some people. They are metabolically intertwined. They're definitely connected. Each one creates the conditions for the other to develop and worsen. And critically, you don't need to be overweight for this to happen. It can happen to people of all body sizes, including people who are lean. These mechanisms operate at the cellular level. They affect oxygen delivery, hormone regulation, nerve function, and the inflammatory pathways I mentioned earlier, regardless of your body composition. Understanding these mechanisms isn't just academic, it's empowering. Because once you know how these conditions are connected, you know where to intervene, where to advocate and get help for your health. If you have one of these conditions, please get screened for the other. If you have both, commit to comprehensive, full person, holistic treatment. Don't just manage the symptoms, address the underlying metabolic dysfunction. And I would love to hear from you. Do you have sleep apnea, diabetes, or both? Have you noticed connections between your sleep quality and your blood sugar? If this video helped you understand something your doctor never fully explained, boy, I'd love to know about that. So, finally, please take care of your sleep, take care of your metabolism, because they're taking care of each other for better or for worse. Remember, this healing journey is always about progress, not perfection. Please take great care of yourself. Self-care is not selfish. Check out the description for my channel and this video, where you will find links to join one of our programs, where you can buy my book, The Yates Protocol, 5 Simple Steps to Fix Your Blood Sugar and Reverse Type 2 Diabetes, Make Peace with Food, and Never Feel Deprived Again. You can also go there to buy CGMs, continuous glucose monitors, if that's helpful for you, if you have any difficulty accessing that technology for blood sugar monitoring, and also ways to join our community via the email list, and other ways to work on your health goals. I'm Dr. Beverly Yates. I'll see you in the next video. Please take great care of yourself. Self-care is not selfish. This healing journey is about progress, not perfection. Are you ready to take the guesswork out of blood sugar control and discover how to turn your metabolism into your superpower? I'd like to give you my free guide to the Yates protocol. It comes with a blood sugar tracker and a meal plan template you can personalize for both plant-based eating and omnivore eating. Getting your copy is simple. Just scan the QR code you see right here. Or if you prefer typing it in, go to this link, https://drbeverlyyates.com/guide GUIDE-reverse REVERSE -TYPE-2 untitled-diabetes-naturally. It's free and it's designed to help you start making changes that really work. The link is available below this video.